Welcome to this meeting of Democrats of Greater Tucson. My name is Larry Bodine, and I'm the president. And our guest today is Pima County Health Director, Theresa Cullen. Give us a wave, Theresa.
Okay, great. Thank you for asking me to come.
Let me tell you a little bit about Dr. Cullen. Dr. Theresa Cullen is the health director for Pima County. She was appointed in 2020, and previously she worked for 6 years as an associate director at the Regenstrief Institute, which is a medical research organization. Her work there focused on the use of appropriate technology to meet clinical needs and improve health outcomes. Theresa is a family physician who was the clinical director at the Tohono O'odham Nation in the 1990s. And after that, she was a Rear Admiral with the U.S. Public Health Service, retiring in 2012 after leading multiple software development initiatives. Between 2012 and 2015, Dr. Cullen worked as the Chief Medical Information Officer for the Veterans Health Administration. She worked to develop a new model for community involvement in health information. And finally, Dr. Cullen has worked to develop population health software suites since 2002, including electronic clinical quality measures and expanded population health capabilities at the point of care. And with that, Theresa, the floor is yours.
Let me start out with COVID, and I'm going to do this just from an epi perspective, what we call the epi cascade. So I'll initially talk about the cases, then I'll talk about testing, hospitals, vaccines, and then we'll go from there. So you are aware we're year plus into the COVID pandemic. The situation in Pima County is not good, in my opinion. We have plateaued at a level that is far above where we would like to be. We are in a fourth surge, as is the rest of the country. The people that seem to have escaped this are California, who are in substantial transmission and not high, and Puerto Rico. And as you guys know, there's many other states in the country that continue to do poorly. And I would remind people this is an international crisis, not just a crisis within the United States. But from the US perspective, from the Pima County perspective, we're approximately anywhere between 170 and 200 cases per 100,000. Anything over 100 cases per 100,000 means that we are in high transmission. If we get below that, we will go to substantial transmission. We have been in high transmission for a very long time right now. You will recall there was a time when Dr. Garcia and I were optimistic that we would come to less than 50 cases per 100,000. We always think of Pima County as having 1 million people. It makes us easy to round up. So 50 cases per 100,000 in a week would mean we'd have less than 500 cases. You may have, if you pay attention at all, you know that every day these days we're seemingly reporting over 200 cases per day. So we continue to have a very high number of cases. That is coupled with what we are seeing in the testing and vaccination. The testing situation, you may be aware, the county under mutual decision making at the administration level decided to move from PCR testing to antigen-based testing. There's multiple issues for this. I would remind you, if you're not aware, that we've spent over $50 million on testing. That is taxpayer money, whether it be county money or federal money, and the vast majority of that was federal money. It's clear that at some point there will no longer be just an open pipeline for funding. And so we have made a critical decision, which can be well justified, to move to antigen testing. Antigen testing is about a quarter of the cost of PCR testing. We are committed to making testing available for free for the community. A lot of this is based on our commitment to justice and equity, and we do not want to be in a situation where the only people that can afford to test are people that have insurance or can go to CVS or Walgreens and buy the test kits themselves. So by doing this, we are reflecting what we see in the county because we have high transmission. During a period of high transmission, the antigen testing sensitivity and specificity is greater. Actually, Pima County is the county where the the Sentinel report was made by working with CDC on the value of using antigen-based testing. So I am comfortable from a science perspective, a medical perspective, and from a fiscally responsive perspective that we have moved to antigen testing. At the same time, we have made a decision that obviously the Board of Supervisors could make a different decision on, but we have put in place that we are not doing occupational and work-related routine testing. Those tests are available in the county. People can seek them from the ASU PCR site, which is at Elletown, and or they can seek them from a personal provider or CVS or Walgreens and other providers of testing. However, we do not want to encourage routine occupational testing other than if people have been fully vaccinated. And what we are seeing is the vast majority of people are doing routine testing because they are not getting vaccinated. And our primary way to get out of this pandemic is vaccination coupled with, I would say coupled with at this point, masking when and if that is appropriate. So let's move to vaccination. You guys know we've been doing vaccines now since December 15th was our first vaccines in the country. In the county, they were at TMC. For those of you who did get that early vaccine, you did get a Pfizer vaccine. Moderna was endorsed with an EUA a few weeks after Pfizer came in. People need to get vaccinated. About 67% of our community who is eligible for vaccination, that means 12 and over, have been vaccinated. Our overall rates for those 65 and over are much higher. They're about 87%. If you are immunocompromised, you get a third shot. And that third shot completes your primary series. It is not a booster, though it is the same shot. So if you got Moderna and you get a third shot, if you got Pfizer and you got a third shot, and you are immunocompromised, which many people claim to be and do not meet the CDC guidance for it, but all you have to do is a test. We don't question you. Then you get a third shot. That completes your primary series. However, boosters are available now. Boosters are available for Pfizer. We do expect that there will be booster availability for Moderna and J&J fairly soon. That is a booster. That is for people that are non-immunocompromised, 65 and over, as well as some other criteria, 18 and over, high risk, either in living situation or in your work exposure. And you will recall that the Committee on Immunization Practices, that last part was the part that was debatable in their last meeting, whether there should be an extension into the 18 and over who were considered potentially high risk and may need a booster. That decision was, I think it was a 9-6 vote. I can't recall, but it did pass. So for the county right now, if you go to a county-sponsored immunization facility, which is primarily our 3 health clinics, as well as our Abrams Public Health Clinic, you can get a third shot if you're immunocompromised. You can get a third shot that's a booster shot, or you can start your series and get 1 or 2 shots. And we have all 3 vaccines available. In addition, we continue to work closely with our schools. We've had great uptake of the vaccine in the 12 to 17-year-old group. Actually, it almost mirrors what we see in the 18 and over group, even though it started later. So there's been significant uptake in that. But we continue to be concerned about the Delta variant, which is approximately 100% of what we're seeing right now in the community. We're concerned about that because of the increased transmissibility of that virus. As we say, COVID right now is primarily a disease of the unvaccinated, and that the Delta variant is seeking out anyone who may be partially or not vaccinated at all to transmit the disease to. So it remains a very significant issue in terms of Delta and the impact that we are seeing in the community. That does not mean that people that are vaccinated are not getting COVID. We know they are. We actually do not know the percentage in the county per se. We know our breakthrough rate would appear to be less than 1%. However, remember that is people that are in the county, that got vaccinated in the county, and whose data we have. But that would be consistent with what we're seeing nationally. So we think that that's pretty close. In terms of hospitalization, our hospitals remain quite full. A lot of this is due to staffing as opposed to beds. So there are beds and wards that could be opened up, but there is not staffing for nursing, for physicians, for hospitalists, for respiratory technicians. What we do know is that we have very limited ICU capacity. There was a time in this past weekend, there was very, very limited ICU capacity. Remember, it's always a moment in time, and 2 hours later, there can be 10 beds. So all we warn people is that the ICU capacity is limited. Our hospitalization for med-surg increasingly gets limited. Pediatric hospitalizations, while they are occurring, there are enough pediatric beds, which is very positive. In terms of the overall hospitalization rates, however, they are remaining high. So at the same time, our caseload is high, our hospitalization rates are plateaued, and they have plateaued too high. And the reason why they've plateaued too high is because we have lots of people that are sick that don't have COVID. And we need to make sure that we have bed availability for them as we go along. So hospitalization remains a concern for us. I'm sure many of you have read about the issues related to the rural hospitals, especially in Southern Arizona, not having a facility that they can transfer a patient to. Having been a rural healthcare provider for most of my career, it is a tragic situation. We have put not only the patients in, but the healthcare systems where they spend 10 hours trying to call to find a place where they can transfer a patient. And when that does not occur, a patient dies. And that's been reported in the press. That's not me making that up. But I would tell you that we have stretched the healthcare system to the max. We have stretched that public healthcare system. My entire staff is totally burnout, and I can't blame them for the last period of time that we've been through. So is there a reason for optimism? I do think there's a reason for optimism. I think we are still seeing people seeking vaccination. We are seeing people masking appropriately. Some of the schools that put that in place, you're probably also aware, we contributed to the Sentinel article on the impact of masking in school-based systems. Maricopa and Pima County, that came out about 2 weeks ago, 3.5 to 3.7 times increase of COVID outbreaks in schools that don't mask. Obviously, the decision whether to mask or not in that situation is based on a school board decision, not the Board of Supervisors. If you follow the Board of Supervisors, you know that they did not vote to enforce masks in schools throughout the county. What we are seeing, however, is that in places where there is more masking, you are seeing rates go low. So what I keep saying to people is, what is California doing different? They're doing lots of things different, but one thing is different is masking. I was actually in San Francisco for a family emergency for a week. And in San Francisco, if you're on the street, everybody's masked. Now, there's limited data about whether you need to do that, but there probably is an important role for masking in indoor activities with people who you don't know in a closed space. So whatever. And the other thing you need to know is I follow this data really closely. I follow the science really closely. Lots of things get published and pushed out, many before they're peer reviewed. Sometimes that is really helpful to see what's being published before it's undergone peer review, but you probably are aware that many times things get pulled back that have been pushed out because once there's been adequate peer review. The vast majority of that peer review is really related to the statistical analysis of the data and if the data is clean data or not. So it's just important to note that we do follow closely what's being published, whether it's been peer reviewed or not. But we, from the Pima County perspective, are very clear that we are pushing out data that we believe is scientifically based. So let me go briefly now from COVID to the other things you're seeing in the county, because these are, while COVID has a lot of airtime, there are other really important things we're seeing. You probably are aware of the fentanyl overdose situation, which is really tragic. And we are not seeing that letting up at all. We've put in place an aggressive opioid plan. But substance abuse requires a multifaceted approach that is not dependent at, I guess all of these problems do, not dependent just upon the health department, but by working with the judicial system and the policing system and everybody else, as well as ensuring that there's adequate resourcing available for people that may choose treatment. And as you guys know, mental health is dismal in, I'd say it's dismal in the county. It's definitely dismal in the US, but there's inadequate resources, especially for those who are lower income and or on access. The other thing we're seeing is an increase in syphilis. This has been reported nationally. The CDC reported this last week. We have the highest numbers of congenital syphilis we have ever seen. That number seems to be increasing almost every week. We put out a health alert about that. However, the vast majority of people that are giving birth to babies with syphilis are women that are not accessing the healthcare system for prenatal care. They're really a high-risk population. At the same time, we have West Nile in the community right now, really due to the increase in rain, which we are all incredibly grateful for. But with rain comes mosquitoes. We did put out a health alert about West Nile recently to providers, asking them to make sure to test for it. Maricopa is seeing the highest numbers they have ever seen. We have significant increase numbers ourselves, and we are mosquito trapping and working with our vector control people as much as we can with that. I'm going to go to funding right now. As you know, that public health systems in America are dramatically underfunded. It's actually an embarrassment. In some ways, I say to people, public health is, a rounding error in the budget situation. We in Pima County, we're lucky enough that we've had significant grant funding that has come through primarily through the federal system. Many of those grants are for 2 to 3 years. We're doing a lot of work around equity. This follows up on what our Board of Supervisors declared racial and socioeconomic injustice as a public health crisis last November. We're incredibly grateful for their support in this arena. We are using this funding to not only deal with COVID, but to also hopefully be able to address some of the underlying causes of inequity and injustice that we continue to see. None of that will be rapid. All of that will be longer term. But just like Rita and Katrina showed what people called the underbelly of America, and I actually was active duty public health service during that and was deployed. This is not the underbelly of America. This is the infrastructure lacking in America, and Pima County is no exemption in terms of the poverty rate and what we need to deal with to address that. But from a grant solution, we actually are doing well. We're focusing on health literacy, equity. We have a small climate change grant because we believe climate change is a major contributor to health, and that funding is very limited, but it does allow us to get into a space where we have not been in as a health department, and we have support to continue to do that. So that is good. Finally, I want to just go to recovery and resilience. Part of our recovery and resilience plan has been the activation of a few committees. One is our longstanding Board of Health, who continues to advise us with people appointed by the supervisors. We have a community-based advisory committee that was stood up for COVID and has continued to work really closely with us and done an amazing job representing the community-based organizations in the county to help guide us. We stood up an ethics committee, a public health ethics committee last fall. This was in response to a limited supply of, at that point, which was a drug remdesivir that was being distributed to the hospitals. That ethics committee continues to be active and advise us and hopefully ensure that we are using principled decision-making when we move forward with where we are going with recovery and resilience. So we are in the process of pushing out after an internal review process, which is still occurring at the current time, where we believe we want to go as the county. So while there are many, many challenges that have arisen because of COVID, there's huge opportunities. We, as a health department, are working with an amazing number of community-based organizations. We just kicked off Shots in Shops, and we're doing that, for instance, with barbershops. We have the opportunity to work with groups. African-American churches have been amazing and invited us in to speak about not only COVID, but about what does science do? What does Tuskegee mean? How do we move forward to ensuring that we are doing collaboration collectively? We have a great relationship with the tribes, with the Thalmatham tribe. Actually, we're out there this week doing some immunizations, Pasquayaki, not traditional Indian Alliance, that's what it used to be called when I was in medical school, Tucson Indian Center. So we believe that as we go to this next period, which hopefully will include a significant decrease in the number of COVID cases we have, but with my personal belief that we're going to be endemic here for a while, how do we use this to push the county to become one of the healthiest counties in America in 10 years. And we have gone on record saying that's our commitment. I have a little hesitation, even though I'm the one that's been saying that, because there's lots of things, right angles coming at us on a regular basis that interfere with that. But I do think from a public health department, it behooves us to be audacious, to figure out how we can work with the county as just one tip of many, many spears that are needed to result in a transformation of the health and equity and justice. You know, the whole JEDI, justice, equity, diversity, and inclusion. I mean, that is a motto for us. And it starts with this commitment to move beyond just equity and the elimination of health disparities, but really to a justice platform. As part of that, we also have stood up a small policy shop. We have never had policy specifically in the health department. This is policy. Public health does do advocacy. Right now, we are doing policy. And what we're trying to do is look at what are the policy levers that will be important for us to seek and be able to achieve and then maintain and sustain any commitments we make. So this is a really long process. This is really freaking hard. Our staff is doing an amazing, amazing job. I applaud the board. I applaud the administrator who have been very, very supportive of the work we're doing, as well as everyone else in the community that's a frontline worker that has really helped us achieve where we are right now. So I'll stop. Thanks.
All right. Well, thank you so much for that very insightful report. I'm sure we all find it very useful. Let's take some questions now. Lillian Fox has a question.
One of the things I wondered is, are you doing outreach to the homeless? Because it seems to me that people who are homeless are the most vulnerable of all people. They don't have access to information about where to go to get vaccinated.
Yes. Actually, we've done a ton of outreach to the homeless communities. We've been working with El Rio. We work with a group from our public health nurses. I feel pretty comfortable that we have done adequate exposure into the homeless community. That doesn't mean that there's been vaccine uptake by every person who is homeless or between homing. But yeah, I'm pretty comfortable that we are doing that. We're in the community a lot. We've done over 500 mobile clinics. We've done more than any other county in the state. We started earlier. We made a commitment. We actually have a long plan for how to accelerate vaccination to ensure equity. Probably one of the first that was done in the country starting in January. So the thing that I still worry about is people that are wage earners that are reluctant to get vaccinated because they don't have any sick leave. And we don't have a way to say to them, if you get ill, we can pay you for 24 hours of work. So you won't lose work. That I think is a hesitation that is underreported. So that's the one that it's actually the community I've been worried about. We recently reached out to some of the construction companies to say, can we come on to your site at the end of whatever your work week is so people can get a vaccine then. But if you think about it, that's a population that really, that may be the time they're spending with their children, and the last thing they want to do is be sick from a shot. And we do have to recognize that, like 15% of people feel ill after they get a shot and may need a day off. So for those of us who have sick leave, not really an issue. For those of us who don't, it's a real concern. So
visiting the soup kitchens and the food bank to get homeless people. And
we work really closely with the food bank and all the soup kitchens, and we've been into all of the shelters.
Good, that's great.
All right, we've got a question from Craig Markin. Go right ahead.
Yes, hello. I am curious about the difference in responsibilities between your position and that of Francisco Garcia, and are they both independent of political decisions from the supervisors, for example?
So Francisco Garcia used to have my job, and then there was somebody or two people in between. He's the chief medical officer for the county, and he's a deputy, I always forget his title. He's a deputy director or something. So he reports directly to, I think he reports to Jan Lesher, who reports to Huckleberry. And I can't comment on his political influence. I can comment on mine. I get to do what I want to do. That doesn't mean what I want to do always gets out, but I feel very, very little pressure. I feel no pressure. I mean, I probably feel pressure, but I ignore it. And so I don't feel any political pressure. What I would tell you is sometimes what seems like really easy decisions that everybody has an opinion on because everybody's an armchair epidemiologist are not as easy when you're really looking at all the data. And I will say that I do work closely with not just the health community, but the business community to be cognizant of what the overall impact will be on the community. I'm really into the Nobel Prize for Economics, so you probably read the Nobel Prize for Economics today. Went to these people that talk about all these natural experiments that are happening that are very unintentional in the community. What I would say right now is we got a lot of unintentional experiments happening in not just in Pima County, everywhere. And what seems like black and white is not black and white. And I'll give you an example, masking in schools. My last public health advisory and the one before that said kids should mask. It's not an option. Kids, schools, faculty, staff, you should be masked in schools. The board knows I think that. Francisco knows I think that. Nobody told me I couldn't write that in my public health advisory, and I wrote it. But I don't make policy. I'm not a politician. I'm not elected.
We've got a question from Paul Stapleton Smith. Go ahead, Paul.
When we talk to Board of Supervisors and policymakers in Pima County, what seems to be the accepted net negative economic impact number, that we can all agree, not just the impact on our medical systems, but, overall, in terms of our workplaces, our workspaces, our family income, broadly, what do you find people say, oh, this has had a net economic impact of $5.5 billion so far? What are your thoughts on that in the conversation so that we can be more effective in helping you be successful in your job?
Paul, I don't know the answer to this. What would be really helpful for me is to have a health economist that could work with me. And we have been trying, we have reached out to the U of A, we've reached out to ASU. Everybody that's in that space is really busy. There is a company called CIA3, and don't worry, I don't have stock in them. I don't even think they're publicly traded. They did some early analysis of pulling employment, business, small business, revenue, coupled with COVID numbers into not a causality, but a relationship. They then quit. They did that about a year ago. They quit doing it. They're not doing it now. We have nobody to help us. You know that, as far as I know, the county does not have an economist. I don't think there's an economist. We would love to work with anybody that would help us. I have a volunteer physician, Dr. Garberg, who actually lives in Scottsdale and decided to help us as opposed to Maricopa and Scottsdale. And he's wonderful. And he and I have actually put together the questions that we really need help answering. And I don't think access to the data is the issue. The issue is that neither he or I are an economist, and we can't figure out how to do that. If you look at, I'm going to go back to the Nobel Prize. If you look at the people that won like 2 years ago for developmental economics, what you see is this real need to do the analysis you're talking about, because just like in healthcare, there is a cost. In public health, we look at years of productive life lost. In healthcare, there is a value proposition of what a life is worth. I hate to say it like that, but it's true. When people make decisions. And so any help we could get, we are very interested in this. From a policy shop right now, we are looking at what policies do we want to float up to our administration for potential inclusion in the legislative process. But we won't make that decision. All we're doing is saying when we look around. So I'll give you a really good example, because we've been pushing on this since they first came here. The lack of school nurses, right? The lack of school public health nurses, the lack of school nursing has had significant impact. And what you've seen because of what they call the ESSER money, the elementary and secondary school money that came into many of the school districts, you're now able to see that there's at least a response to that. But that's like a policy issue for us. But this whole issue is, because I think it's a critical question. Where is the bending the arc in this? And I don't know the answer.
Go ahead, Shirley.
Very basic. Is there a difference with COVID between a booster shot and a third shot, such as the dosage or what's in the shot?
That's a great question. There's no difference right now between if you got a Pfizer because you were immunocompromised and got the third shot to complete your primary series. There's no difference than if you get a Pfizer booster. What's unclear is people that needed 3 shots to complete their primary series, do they need a 4th booster? And nobody knows the answer to that question right now.
Sandy Salz has a question. Go right ahead, Sandy.
In the Pima County hospital world, have there been any or many surgeries deferred because of resources being expended on the willful unvaccinated?
Well, I don't know that I can answer the last part of the cause of it, but we do know early on, you'll recall in the winter, January and February, there were cases where surgeries were deferred. I hate the word elective surgery. I realize some surgeries are elective, but most of them aren't. They just are non-emergent. Right now, as far as we know, that is not occurring. That surgeries are not being deferred because of COVID. Now, the next logical question to me would be, however, but you just said there's times when there's no ICU beds. All I can do is report what we're hearing from the hospitals, and it's that they're not deferring surgeries right now.
Thank you.
Nancy, please go ahead.
Yes, thanks. Hi, Terry.
Hey.
So I wanted to, just like Paul, I was really interested in the creation of this policy group. in subdivision or however you frame it, in the county. And I'm wondering if sort of in a generic way, if there's some way for us who are interested in the development of policy, if there's some way for us to stay in touch with that and what's happening and progress that's being made, or is that a little premature?
I would say that's really important and we hadn't thought of it. I was active duty public health service. Boris Lushniak was acting Surgeon General for forever. He's a wonderful Surgeon General. Most of you probably don't know his name because he was under the radar, which is why he was so good. And he was apolitical because he was a career public health service officer. He's now the dean at Maryland's School of Public Health, University of Maryland, which is really a primo site. I'm doing some work with him on some policy stuff, not just, actually most of it not related to Pima County, some historical stuff I've done. And he's the one that said to me, you guys should really look at doing a small policy shop, because we say it's a core function of public health, and yet we see most public health departments not doing anything there. So we got a plus up in our budget. Once again, thank you, Mr. Huckleberry and the board. In February, it took us till very recently to hire people. If people want jobs, be aware there's at least 80 positions advertised for the health department right now. I'd love to get them filled. Maybe we could follow up with you about how I create a nonpartisan approach to community engagement in policy, because I don't know how to do that yet, but I'm really intrigued. And I would say our ethics committee, our board of health, and our community advisory committee, we've really taken this nonpartisan approach and it's been highly effective. So I think there's a space. I just got to figure out how to do it.
That'd be great.
Question from Mike Humphrey, a member of the Pima County Board of Health. Go ahead, Mike.
Hi, Terry.
Hi, Mike.
You probably know what I'm going to ask you, but I'm just going to ask you anyway. The Board of Health just recently made a recommendation to the Board of Supervisors to do background checks at the Pima County Gun Show. So we did that, and that's being worked on by the Board of Supervisors. What I wanted to ask you about, though, is do you think it's time that we set up a task force to take a look at gun violence in Pima County, given the fact that the numbers are rising, the homicide rates are rising? We had 600 gunshot wound victims last year, and the numbers are, I think, bigger this year. So we didn't get a chance to talk on the phone, and I'm sorry about that. But since you're here and I'm here, what's your take on doing and creating a task force to take a look at gun violence?
I think that's would be great. I think we have to look at gun violence. I will tell you from and I'll just invoke the opioid stuff here. We have done a lot of work looking at the opioid crisis from a holistic model, right? In terms of what's the role for the health department, what's the role for TPD, what's the role for community-based organizations. And that's driven by increasing overdose death rates, right? So if we look at homicides, and we know the numbers are really high, and I think it was just in the paper the past few days or something, I think it is appropriate for the health department to look at this. Obviously, it's not just a health department issue, right? But from a public health perspective, it is a public health issue. And it's kind of where we inveigle ourselves into the areas where we believe public health has a role to play. And I think in this one, it does. So.
Thank you.
Let's turn to Barbara Warren.
She just wanted to know if there was any interest in her contributing to Dr. Cullen's climate change grant efforts.
Let me do a little plea on this. I think climate change is huge, right? We just got a small, what we call BRACE grant from the CDC through the state to us. Pima County had one of these a few years ago. I guess because of COVID, we let it lie dormant. I actually think we have this opportunity to really push on this. We are taking pieces of different individuals and assigning them to try to get enough people to support this work. But if people are interested in being engaged, it would be great. It will be, while we got the grant, the health department got the grant, we are working with other parts of the county. But yeah, so if people are interested, that would be awesome. So I see your info. Hi, Barbara. Anyway, Barbara also got me through medical school. I had a lot of help.
We have a question from Molly McCasson, former city councilman of Tucson. Go right ahead.
Thank you so much, Larry. And thank you so much, Dr. Cullen. Your work has been so profoundly helpful. You came at just at the right time, and it's a really difficult time. I was going to ask you what your take was on gun violence in Pima County. It's considered an epidemic in America. It costs us millions of dollars, though those numbers are buried, but it costs us a huge amount of money in terms of our healthcare system every single month. And so I guess I'm wondering where it stands, gun violence, in the overall health profile of Pima County. Does it come forward? As far as I know, there's really no looking at it as a one of those issues that's a real problem in Pima County. And maybe I'm missing something. Doesn't gun violence have a role in that profile? Shouldn't it have a place?
Yeah, so Molly, these are great questions. And actually, some of the costing data we did, even though we are not economists, we did a little bit of analysis at Mike's behest for the Board of Health. There's the CHNA, the Community Health Needs Assessment, which is done routinely and then is used to contribute to the strategic planning process within the Pima County Health Department. That the data rolls up to the county, but the health department does a more specific process. I will tell you, we also did to start a new strategic plan in the fall of last year, almost a year ago now through February, we did a large survey of approximately 2,000 people. And we did see not gun violence per se, but what we see is homicide and suicide come to the forefront in those surveys, as well as behavioral health and substance abuse. So it is on the radar. I think Mike has successfully identified it as an issue and shared that with the Board of Health, which is our advisory group to the health department. And that guidance from him and the Board of Health has been critical, right? Because the way things get on our radar, obviously I can put stuff on our radar. I can put congenital syphilis on our radar because you guys don't know about it and it's a mess. To get something that like gun violence has to come from Board of Health, which Mike has done. And then I just want to re-echo, we really are we are nonpartisan. We have to be nonpartisan. Our real goal is, but that doesn't mean we skirt away from the scary stuff, right? The scary stuff is the stuff we really need to be attentive to. But Mike has been an advocate since I've been here to try to get this. And in the past few months, he's been outspoken. And the incredible sad part of this is as homicide becomes a huge issue and suicide in not only our community, but the country, I think there's more people now willing to look at it. The issue becomes looking at it, getting the data together, and then making a recommendation. And then beyond that, it is at the political level for us at least.
All right, we've got a question from one of our board members, Susie Anderson.
Hi, Dr. Cullen. It's a real pleasure and honor to listen to your talk. My question is, number one, is there an increase of flu vaccines? How are the numbers of flu vaccines doing in the county, especially compared to COVID vaccines? Are you aware of how many flu shots are given, and are they keeping up with COVID because we're getting into flu season?
We do monitor the flu shots. I actually don't know the number. We are now giving COVID and flu vaccine together at many of our sites. So if you go to one of our clinics, you can get either or both of those if you need them. We are all concerned that we may have a really accelerated flu season this year. We're not seeing that yet. We will be monitoring it closely. We are seeing an increase in RSV in our kids, in our adolescents. So we know that respiratory syncytial virus is much higher. Initially, we thought that might be just the result of screening, right? So more people, if they go to a pediatric office, they're more likely to get what we call a respiratory panel. But we've determined that we don't think that this is just due to increased screening. So, Susie, it's a great question. We're just going to stay on top of that and really encourage people to get their immunization.
All right. I think we have time for one last question. Let's turn to Lillian Fox to bring the questions to an end. Go right ahead, Lillian.
Great. Thank you very much. I wondered if you had talked to the Business Research Division of the University of Arizona. Years ago, I worked for the Business Research Division of the University of Colorado. They were heavily involved with economists who work for industry, less involved with the university industries. And I would think their businesses are heavily affected by COVID. And I would think that if the University of Arizona Business Research Division reached out to business economists, you might find some people who are really interested in working with you.
Yeah, we haven't done that. So if you can give us the contact information, we can do that. It sounds great. Thank you.
Mm-hmm.
All right, Theresa, we've run out of time. I was wondering if you could close out our meeting. Tell us how we can support you in your efforts. And a number of people have asked in the chat how they can get a hold of you.
So I'm just like every county employee, the secret, Theresa.Cullen@Pima.gov. There's an H in my name. So THERESA.Cullen@Pima.gov. We're public servants, so we can't be anonymous. I wish there's days I wish they were. I think one of our roles is making sure that we provide appropriate information to the community and the community makes the best decisions they can. Obviously, as you may have heard in my voice, we more than welcome people helping us, being volunteers. We have the ability to have people volunteer with us, and that doesn't mean you just have to give shots, right? So this Dr. Garberg, who I talked about, is the volunteer in residence who just helps me figure out where I should go next. So if people are interested in working with us, if you reach out to me, the best way to do that would be through email, and then I'll put you in touch with our volunteer coordinator. The reason why we do that is we just like vet people, make sure they're reasonable. Don't worry, it's not like politics or anything. It's just like, are you alive? There's multiple opportunities. I will say it's been my privilege to be the director of public health. I did not take this job thinking it was going to be a pandemic. I have an amazing staff. And like I stated before, I'm grateful for, even when it's acrimonious, the Board of Supervisors' insights and support, and Mr. Huckleberry and Ms. Lesher and Dr. Garcia. There's a whole lot we all need to do. And the faster we can figure out how to collaborate and consensus build, the better it is for all of us. So thank you for the opportunity, Larry. Thanks, everybody. Let me know if I can help you in the future.
We do have a couple of announcements. Why don't we start with Christina early? Unmute yourself and tell us about some fun that's coming up.
Hey, everybody. I hope that y'all are having a good Monday. Wanted to let you know that we booked our next Drinking Democratically happy hour at Brother John's on October 27th from 4 to 6 p.m. We went there in August and had a pretty good time. They're looking forward to taking care of us again. In the chat, I put the information for registering. So check that out. If you could please register, that just gives us the ability to let them know how many people are going to be joining us. We had a great time at the happy hour a couple of weeks ago at Augustine's Kitchen. Had 24 people join us, had some great conversation. So if you're jonesing to get to talk politics in person, mark your calendar for October the 27th. And I hope that everybody registers and we'll see you there. Thanks.
Awesome. Thanks so much, Christina. We appreciate all your hard work. Let's turn to Kathy Ramage-White, tell us about why people should join Democrats.
Hello, everybody. Well, joining Democrats of Greater Tucson is where all strong Democrats can be. That's where we can hear Democrats who are running for office again, who might want to be involved more deeply with the party. And this is the place to be. You can go to the Democrats of Greater Tucson or the DGT.org and just click on join us, and you are welcome for only $20. And then you're a member for a full year. That's good stuff. So we're the place to be, and we hope you'll join us. Thanks a lot, Larry. Back to you.
Well, thank you so much, Kathy. I really appreciate it. And now let's turn to Sandy Binion, who's going to go over some of our upcoming programs.
Thank you, Dr. Cullen, for accepting our invitation to speak today. I have coming up next week Aaron Lieberman, who is a candidate for governor of Arizona. And the following week, we have Adrian Fontes, who is a candidate for Secretary of State of Arizona. And then the following week, we have Chris Mays, who is a candidate for Attorney General of Arizona. So we have some interesting speakers coming up.
Theresa, thank you so much for coming to this meeting of Democrats of Greater Tucson. I've been taking notes like wild. Your information is tremendously valuable, and we really appreciate everything you're doing. So keep up the great work. And with that, I'm going to conclude this meeting and wish everybody a good week, and we will see you next Monday.